Good morning, Jamaica. It is Wednesday, June 10, 2026, and we're here for another post-cabinet press briefing. And I have brought out the heavyweights this morning to be with you, and it is going to be a very good press briefing. I'm just reminding you that we do have an official funeral that's coming up right after this, and so we have to keep the post-cabinet press briefing tight. But that doesn't mean that you're not going to get a lot of very important information this morning. And let me start by acknowledging those who are here with us today, starting with the Honourable Fayval Williams, Minister of Finance and the Public Service. First woman in that role, doing an awesome job in that role. We know the hurricane season is coming up, and she's had to be working really hard to ensure that we continue to have the kind of insurance coverage that is necessary for this country. And we are very happy to have her here. I can tell you everything I've asked her for in education in terms of funding to rebuild schools she has given us. And so we're very happy to have you here, Minister Williams. We also have Dr. the Honourable Christopher Tufton, our Minister of Health and Wellness and having more babies. It's good to see you here, Minister. And he has a lot of updates to give you today, and we're looking forward to them. Right, Minister? I'm sure there's some in the audience. All right. We also want to acknowledge the Honourable Pearnel Charles Jr., our Minister of Labour and Social Security. And I want to add something onto it, but I'm trying to be diplomatic today. But the person who has really been implementing that ROOFs program. We know so many people in the West have lost their roof and their homes, and he has been working tirelessly with his team to ensure that the funding gets to those who need it the most. Also want to acknowledge Mrs. Dion Jennings, the Acting Permanent Secretary in the Ministry of Labour and Social Security. We are supposed to also have Dr. Jacqueline Bisesa-McKenzie, the Chief Medical Officer, Dr. Kirk Benjamin, Acting Commissioner of the Jamaica Customs Agency, Mrs. Terry Ann Thomas Gale, Chief Education Officer, Professor, the Most Honourable Denise Eldemeyer Shearer. We've never had you here, and it's so good to see you here this morning. When we have persons like you at a post-cabinet press briefing, we know it's going to be a special morning, so welcome, and it's great to have you here. I also want to acknowledge the senior technical teams from our various ministries that are here. We have some student leaders who are going to be here with us. Brian Anderson, who is the president of the National Student Council, and other members of his team. As always, members of the media, Jamaicans watching at home and abroad, good morning again to you all. Given how many ministers we have this morning, we are going to go straight into their presentations. All of them will be around a theme of how we have been spending after Hurricane Melissa in terms of what we have been prioritizing and how the funds that the government has been used. But each of the ministers will also update you on other issues that are important in their portfolio. And so we're going to get started with our wonderful Minister of Finance and the Public Service. So please welcome the Honourable Fayval Williams.
Good morning, everyone. I know in the interest of time, I'll observe the protocol, but just to say, colleague ministers, PSs, my acting commissioner from Customs, members of the media, Mrs. Shearer, students, Jamaicans all. I'll speak to three issues this morning. And the first has to do with what has been circulating in social media about $100,000 Jamaican. Whether or not you can bring that into Jamaica. And I'm here to say that that information on social media from someone who purports to be a lawyer is incorrect. Persons traveling to Jamaica can bring cash in excess of 100,000 Jamaican dollars. You have to declare if you are bringing in US 10,000 or the equivalent. You have to declare it on your Enter Jamaica electronic form when you fill that out. So then, if we're saying to you, coming into Jamaica, you can declare if you have US 10,000 or higher or equivalent, then we're also saying to you, you could bring in less than US $10,000 without declaring it. So how did this Jamaican 100,000 come into being, into the conversation? It does exist in law, but it is a security threshold. So our security, including customs, can, if they suspect someone to be coming into Jamaica and they believe them to be carrying whatever, they can question that person. They can, investigate. And the 100,000 comes about because the law says, that's the threshold. So if somebody's coming in with less than 100,000 in their pockets, you wouldn't necessarily go after them, right, Assistant Commissioner? So that's where the 100,000 comes in. It's just for law enforcement, and it's a threshold so that they're not wasting their time pursuing somebody who's coming in with less than $100,000. So I hope that's clear. Clear, everyone? All right, good. All right, so the next of the three issues, the next would be the Melissa allocation. I know that has been circulating in social media as well, the $67 billion. So I'm here to just walk through pretty quickly where that went to, what ministries, and how it got there. You will recall that during the last fiscal year, we did a third supplementary and we did a fourth supplementary in order to allocate funds to ministries. And in the third supplementary to the Office of the Prime Minister, $189 million. And you can tally along and see if you get to $67 billion. Ministry of Tourism, $3.4 billion to support the tourism sector. You know that sector had a lot of damage, to support the workers in the sector as well. Ministry of Economic Growth and Infrastructure Development, $7.5 billion. There's a lot of roads to be repaired, lots of debris to be cleared, and so on. Ministry of Finance, $57 million. Ministry of Water, Environment, Climate Change, $3.2 billion. Ministry of Labor and Social Security, and the minister is here, got, to start with, $1 billion. And then there were additional sums totaling altogether with the $1 billion, $1.2 billion. And I'm just reading through the allocations during the third supplementary. Ministry of Education, $2.3 billion. Ministry of Health and Wellness, $1.965. If you want to roll that up or round that up into $2 billion, that's what that is. Bellevue got an allocation of $35 million. Ministry of Culture, Entertainment and Sports, $280 million. Ministry of Agriculture to help in that sector, farmers, fishers, $3 billion. Ministry of Industry, Investment and Commerce, $20 million. And you'll recall that Minister Hill helped businesses in Border, if I recall, to put their shops back together. Ministry of Energy, $1.5 billion. There was quite a bit of damage at Petrojam. Ministry of Local Government and Community Development, 4.6 billion. That's a total of 29.4 billion. Then you add to that the 24 billion that was loaned to JPS, and that brings you to 53.6 billion in the third supplementary. In the fourth supplementary, there was 3 billion at the Ministry of Finance, Ministry of Labor, 10 billion, right? And that was for all the roofs, the roof program. Ministry of Health and Wellness, 400 million, which takes us to 13.4. When you add those two numbers, with $67 billion. All right, and then my third topic has to do with the issue that came up in Parliament around FSC. But before I get to that, I want to say that I'm pleased to report significant progress on the regulatory reforms that I announced in my budget speech to mobilize long-term local capital for productive investments. Our objective is clear: unlock patient, long-dated resources while preserving financial stability. On pensions, we will proceed with the first phase to relax private asset limits from 5% to 7.5% on July 1, 2026. So in a matter of days, releasing meaningful long-term capital for corporate and project financing, and we remain on course to reach 10% on April 1, 2027, subject to any regulatory review. We're also updating insurer investment eligibility to broaden access to sound domestic corporate debt. The FSC has indicated that the proposed amendments are expected to be with the drafters by the end of this week. And I want to thank the Financial Services Commission for its diligence and the alacrity with which they took this up. We will continue to consult the central bank and stakeholders to implement these reforms in a calibrated, stability-preserving manner, and together we will channel savings into productive, inclusive growth. And then, as to the specific question that came up in Parliament, you will know that from time to time, and based on government's revenue requirements, the financial sector may request distribution of surpluses, reserves, or financial investments in excess of requirements for working capital from self-financing agencies. Such requests are generally made after an assessment of the agency's financial position to ensure that any distribution will not undermine the entity's viability. Based on the strength of the FSC's balance sheet and based on the projections of the institution, both the FSC and the ministry had a joint understanding that the 500 million distribution would be granted. Additionally, the ministry had committed then to ensuring that we remain in close contact with the FSC. Of course, we always will. And in the case of any financing needs from the FSC, we stand ready, and we did put that in writing to the FSC. So there is no risk to the viability of the FSC from the $500 million distribution. Thank you so much.
Thank you very much, Minister. You heard her outlining how much money has been allocated to various ministries, and it has been a lot of money that has been allocated for hurricane relief-related efforts, and we want to thank her and the ministry. And she also went into some details on a few other important things that are in the public domain. We will take some questions after all of the ministers are finished. And remember, we do have Jamaica Customs Agency here too, so you can direct questions in that direction also. So up next is the wonderful Minister of Health and Wellness and other things, who is going to come and give you his update. Welcome, Minister.
Thank you very much, Madam Minister. And just to be clear, I'm not on the market, okay? But I am encouraging it, that's for sure. Okay, so good morning to you all. So many of you here. Just to recognize my team, who are well populated in the audience. I want to just single out Professor Eldemire Shearer, who is here as part of the team, even though she's an independent professional. But I'll get back to her role later, and if there are questions, I'm sure she'll take. The rest of the team, how are you, Dr. Dawkins, right? And my other team members. I want to recognize my colleagues, of course, my Minister of Finance and the Public Service, who has a little sniffling and so on, so please treat her good, okay? And of course, the man with the plan for those who have been impacted, Pearnel Charles Jr. From Good Stocks. I want to recognize him and their teams. So my intervention is primarily around what we have done to date. And I really want to pay tribute to the healthcare workers during this period of Hurricane Melissa in the immediate aftermath. Indeed, prior to and then in the immediate aftermath, and then what's happening here now. If you really think about it, we didn't have a lot of complaints as it relates to health response. And hospitals were damaged, health centers were damaged, over 100 health centers. All the hospitals in the zone were damaged. Many had to be abandoned, Black River, for example. And healthcare workers were impacted. So the National Health Emergency Operations Center was quick on the draw, certainly before the hurricane, as we normally do, to actualize the plan and to mobilize the center. We deployed some 604 international medical personnel, along with our healthcare workers, well over 500. These are those that went into the zone. And the zone meaning, of course, the 5 parishes from St. Elizabeth through to Hanover, and including Westmoreland, of course, and Trelawney, and which other one? Well, parts of St. Ann and a little piece of Manchester also. So we quickly were in touch with the NGOs, with the external support, and we were able to give them credentials to come in. So we had a real army supported by that team, and it took some effort and resources in some instances. We rescued some 96 Jamaicans from life-threatening injuries. Many had to be airlifted with the help of the JDF, 10 persons, and an additional 8 in the first 72 hours. And so we saved lives, the team. And we attended more than 8,900 persons in our makeshifts A&E and temporary posts that were established, taking care of some 3,000 patients who were in hospital along that belt in the first 24 hours, even with leaking roofs, rearranging ward space, moving people out and in, providing them with meals when cafeteria, it was a sight when you visited Trelawney, Falmouth Hospital, and saw the cooks outside under the elements, preparing meals for the patients, literally, while rain falling them out there, because there was nowhere to, the kitchen had lost its roof. We attended, so we took care of about 3,300 patients that were already admitted. And the first week we deployed a field hospital and catered to about 42 NGOs, many of them coming into the country. You may recall that within 5 days we had a full-fledged hospital at the Black River High School, because Black River Hospital had to be abandoned. And it wasn't a tent. It was a high-tech hospital that was flown in, transported. it had A&E, it had an operating theatre, it had a pharmacy equipped, it had ward space, and it had doctors. And again, that took a lot of organizing. We never had a dengue outbreak, which, again, we underestimate that. But it is normally automatic after such a weather storm to have waterborne illnesses. We had leptospirosis, but it was short-lived because the team was deployed, 177 public health inspectors, and we controlled that. It could have been a lot worse in places like St. James, Montego Bay, Catherine Hall, where the mud and the dirt and everything came down with the flooding. And we had 1,100 vector control workers to visit homes, to spray, to treat water, and we did not have a dengue outbreak, which is phenomenal in the positive. And then we had 3,000 healthcare workers who were themselves victims. One of the dilemmas we had to confront was that there were workers who were marooned in their communities or trapped in the hospital. They didn't know what was happening at their homes. They just heard by the way, and we had to coordinate that communication. In terms of the response since the passage, we have 3 phases that we have worked on. Relief, rehabilitate, and to reconstruct. The phase 1 of the program focused on restoring essential services in the primary, secondary, and tertiary levels to protect the population from outbreaks, which are normal risks in these times. Phase 2 is to organize into 4 integrated components designed to restore infrastructure, strengthen resilience, and advance the healthcare system reform. So we saw in the disaster an opportunity, not just to restore, but to build. And we went to Cabinet early, and the Cabinet, in their wisdom, led by the Honourable Prime Minister, gave us permission with a plan that the team constructed even before the hurricane, but certainly refined after, to establish a unit. We have a couple of members of the unit here, Mr. Parham and Mr. Chin, who is now built out, similar to the NARA establishment, although everything will fall under NARA. But we were quick on the draw because of the sensitive nature of health and the fact that lives depended on it. Despite the inconvenience of everybody, if you don't have a functional hospital or health center, people will die. And the Cabinet gave us the quick go-ahead with the support of the ministers, Minister of Finance, to move that. So the phase 1, we have been able to put in place and restore these facilities where they can be restored. I must say that it's not perfect and maybe even not so comfortable. So, for example, repairing a roof, a zinc roof on a health center, going into the summer, it will get hot until we can properly restore. And the team is looking at doing some things there. Phase 2, we focus on the modernization of Savlamar Hospital and other entities that we have been working on. Savlamar Hospital had a plan. We're costing out the plan to build a new A&E, and that you will see ground broken on that soon. And then phase 3, using the Powerhouse Smart Health facilities, we have invested and have started to assess 101 health centers in the zone, 41 facilities under the primary healthcare reform agenda to expand service capacity, improve patient flow, and enhance infrastructure. And those have commenced. We have engaged engineering firms, I think it's about 4 or 5 of them, and they're in the field working now. And component 4 is would have been to establish the project execution unit, which I spoke to earlier. So the current situation, quickly, with much effort and some resources, is as follows. We are in receipt of 64 briefs of the 101 health centers to be repaired under the phase of building back and building back stronger. Design firms are working to complete the remaining as we move to reviewing and validating the design briefs and respective regional and parish health teams. The next steps will be to move the construction drawings and tendering process for these health centers. So we did temporary makeshift restoration But then the team went in to check the walls, the integrity of the wall, to see if the building should be abandoned, should it be rebuilt. And also, in the case where we need to do some expansion, recommendations were made according to that. Still some process to go. Some of the health centers are not owned by the government, so we have land issues to sort out, space issues to sort out, but the team is on the ground and working. The long-term view is to move to address with these work, waterproofing and leak control, power continuity and life safety, ventilation, cooling, and IPC upgrade across the clinical areas. The governance and risk management, I want to advise that the program will be governed by a program steering committee, this program. It is being governed, which provides strategic oversight and accountability, approve plans and scope changes, review progress, risk, oversee procurement strategy to ensure that under the smart facility, there is a sort of regulatory oversight arrangement. So we have a project steering committee that is chaired by engineer Mr. David Chung and includes the Chief Medical Officer, Jacqueline Bisesa McKenzie, Chief Program Officer in the Office of the Permanent Secretary, Ms. Kadian Birch, Chief Technical Director, Dr. Paul Wright, the Technical Director for Health Infrastructure and Project Management, and Ms. Devita McLaren of the Western Regional Health Authority, RD, and Mr. Michael Bent of Sierra, the two regions that have been impacted. That team is supported by ex-officio members, Mr. Ian Stein of the PAHO, WHO, headed in Jamaica here, and Mr. Carl Mackenzie Chin, who is here in the audience. You probably won't recognize him by his name. Right, Carl? Right. But he's the program director, right? So he is the man driving the coordination of the unit. Okay, now in terms of expenditure, the government, through the Ministry of Finance, has extended some $3.82 billion in repair works at the affected health centers and hospitals, which has positively impacted a number of services and indeed Jamaicans. It is estimated that some 300,000 Jamaicans would have been served from the initial expenditure. And it was bad. I mean, you've heard the news on Cornwall where large sections of the roof had gone. We had to replace those. We lost the maternity ward at Noel Homes and the staff accommodation, and I could go on and on. So 3.8 billion so far. 300,000 Jamaicans we feel have been impacted. The staff welfare, some 2,600 healthcare workers were assessed as needing support, with the majority from western and southern regions. And we have had a multidimensional approach to giving them psychosocial support, some funding support, basic materials and so on, to help them to be restored, both mentally and materially, to continue the important frontline work that they do. Some of the tangible efforts, we've organized a series of healthcare workers fair, which gave healthcare workers opportunity to replace lost or damaged documents, including passports, birth certificates, land titles, TRN. We arranged with different agencies to meet because many of them lost some of their important personal documents. Supported workers, counseling and human resource management provision through employee-assisted program. Coordinated the distribution of care packages through the regional authorities and cleanup activities in major health sites. What was heartening about this is that we bussed people from the unaffected areas into the affected areas and had work days, and that was quite heartening because people came together to help each other. Phase 3 quickly will focus on strategic reconstruction, which is a more long-term. So we're looking at site analysis consultancy that has been signed, supported by the Inter-American Development Bank. We're now doing an ecological study on Black River, Falmouth, Trelawney, Noel Homes in Hanover, to determine, even while we repair for services to be resumed, whether the long-term strategic direction should be relocating those institutions, which are right on the coastline. The IDB is supporting that. I think they have allocated maybe 100,000 US or something like that, I'm not sure, to that study, and that study is now taking place. That will become now the basis on which we determine where we go in terms of some of that relocation. And that is in keeping similarly with the secondary care reform that will take place. So in summary on this, I think, and again, I'm probably not the best person to judge ourselves. You have to be the determinant of that, but I'm not going to speak for myself. I'm just a servant. I'm speaking for the people who are on the ground. And I must say that the team, under the circumstances, did very well. And we need to celebrate them for their efforts, because lives, many more lives could have been lost if it weren't for the immediate response. And yes, we had to spend resources, but that's the nature of an emergency. I think maybe the COVID experience also sharpened up our emergency response. And we will keep the public informed in the next few weeks. My intention is to report from a parish-by-parish basis as to the extent of the final assessment of health centers and hospitals. So Black River, for example, is now putting on back the roof. The operating theater is finished. They're going to be working on the admin ward now, wing or area. But we should be able to move back patients in the 2 male and female wards within weeks. And it's looking very nice. And they're slabbing the roof, so hopefully no more hurricane damage. And I could go on and on. So we're going to be doing that kind of reporting over the next couple of weeks as we go along. I want to turn quickly to Ebola. Since the release of the ministry's public service announcement on Monday, May 25th, ministry can confirm that 9 passengers from several flights into the country had a travel history associated with the affected countries. These individuals had received counseling from the airport health desk, placed under mandatory self-quarantine, and are being monitored by the respective health departments. Importantly, all 9 passengers have not manifested any symptoms associated with Ebola. Therefore, transmission is not likely, and there is no risk as it relates to the other passengers on these flights. I think that second part is very important. I don't want a rumor to start that 9 people in Jamaica have symptoms of Ebola. That's not the case. It is the precaution that is necessary in keeping with our international obligation. They are coming from countries that are impacted. They have been vetted by Port Health, as is the customary practice, particularly when we're on alert, as we are, and they are engaged in self-quarantining. And don't worry about the self-quarantining. You may ask, how we know? We have 23,000 health workers throughout the country at the level of parishes, and they will be visited. I can guarantee you that. So we will monitor that, but there's no symptoms and indeed no suspicion or suspected case except for the precaution that's necessary. So the risk to Jamaica remains low. The scale and trajectory of the outbreak warrants enhanced preparedness measures in accordance with our WHO recommendation for countries assessed as having low risk of importation. So in keeping with the WHO temporary recommendation issued to countries at low risk, we have intensified preparedness activities aimed at ensuring the early detection, reporting, and safe management of any potentially imported cases. The ministry has adopted a risk-based approach, as we normally do, enforcing the first line of defense, which is the points of entry, and the measurement for containment of persons who may be infected, to include the following: enhanced vigilance in the surveillance system. So you may have to be stopped and interrogated at the airport or at the ports, the ship, the cruise ships, and we have the authority in law so to do. And persons should be prepared for that if they are at a risk. Enhanced coordination among border agencies, sensitizing frontline personnel, reinforcing standard infection prevention and control measures, assessing readiness at the designated points of entry and isolation. As part of these preparedness efforts, assessment and sensitization activities were conducted at Jamaica's major ports of entry, including the 2 international airports, the historic Falmouth cruise ship pier, and Port Authority of Jamaica. In addition, preparedness meetings and sensitization sessions were held. Key stakeholders, including the medical officer of of health, senior medical officers, regional technical directors, immigration officers, island-wide senior management representative of the Port of Jamaica, Port Authority, and other crucial public health and border management personnel. To date, we have sensitized some 1,100 key personnel from these institutions and agencies and have been sensitized and reminded the role and functions regarding the current Ebola outbreak and Jamaica's preparedness arrangement. We have a good emergency response team, I think, our health team, and I think they deserve, again, recognition. Previously announced, keeping with our port entry surveillance protocol, the health team in at Jamaica's ports of entry have ramped up surveillance and travel to transmitted from countries which are affected by Ebola to last 21 days, who have traveled to, transited through Ebola-affected countries. You are likely to be quarantined. So those who have intentions to travel, we know because the flight itinerary is communicated to us. You don't need to declare, we know. And you are going to be quarantined. So maybe you should avoid it or be prepared for the consequences after the fact in the interest of yourself and the country. So we're urging you to review your travel plans and avoid traveling to or transiting through affected country. Again, I repeat in closing of this section that Jamaica remains Ebola-free. Jamaica remains Ebola-free. Knock wood and give God thanks and ask for guidance, all right? The final point I want to raise is on the community-arranged response efforts, which is why Prof. Shearer is here. So if you have questions, she's the best one to ask after. So you may have heard the sectorial where we announced a social determinants of health agenda, the CARE agenda, and we have commenced in earnest to do a few things. We have outlined a community-arranged response that looks at a number of areas in keeping with the primary community health care approach. It's one thing to build hospitals and health centers, but that's curative. We have to prevent. And so we have to attack the supply and the demand side. And some of the obvious things that we ignore are the major causes of us hospitalization. But in this instance, we're pleased to announce that we began work in the area of around healthy aging. We have an aging population numbering some 375. And in another 20 years or so, we're going to go well over 400, 500,000. It's, by the way, it includes some of us, right? So we have a direct interest in making sure we take care of our aging. And we don't say old people, by the way, we say aging, okay? The right protocol. So on Tuesday, I attended and participated in a series of training of trainer workshops looking at the role of caregivers for older persons or aging persons. This initiative is led by, as I said, Professor Eldemire Shearer and her team at the Mona Aging and Wellness Center with the support from the University of the West Indies and the Inter-American Development Bank. The approach here in the first instance is to train unpaid caregivers. I want this to register. There are about 100 to 150,000 Jamaicans in Jamaica who are aunties, uncles, cousins, neighbors, church brother, church sister, who look after their neighbor, who are their brother's keepers. And it's a fundamental feature of community and family that we need to preserve and enhance. They are not paid, even if they're given a stipend. Without them, those persons who are stroke victims, autistic children, people who have had heart attack, people who are just old with multiple chronic illnesses, can't turn, can't cook, can't clean up the house, who just want company because they're lonely and they need someone to talk to. We have to get to the point where we encourage a more compassionate society, a gentler society. As a country, we have become very individualistic. It's just about me, myself, and I. And these unpaid caregivers are actual heroes that oftentimes go unnoticed. So we are tackling that by helping them to be more effective and recognizing them in the process. And Prof. Shearer, who is a geriatric physician, is driving that, and we're training trainers first. And in due course, we're going to be issuing a call across the country through the faith-based organizations and others to participate in these online training. I should mention we're coordinating with the Ministry of Education to use their facilities, whether Hart or schools. I want to thank the Minister. She has been extremely supportive of the effort. And we will be coming to a location near you. And of course, how can I forget the Ministry and Minister of Labour, who has a welfare, social welfare component to supporting the aging. So it's a truly collaborative effort involving all of us. I saw a minister there working out in Montego Bay recently with, he looked like the younger one there, but maybe it's because of his hairstyle. I'm not sure, but he was having a good time with a seniors walk and workout in Montego Bay. And that's something that we're going to do a lot more of. We have to come to terms with taking care of those who took care of us, pretty much. And more will be said on that, but the aging process is approaching 400,000 Jamaicans and will continue. And we want to help them and help those who are helping them. As I said, international estimates suggest that almost 75% of long-term care is provided by family members and community caregivers, quietly, selflessly supporting their loved ones each day. And, with an estimated 150,000 or so, we have to help them so they know the meals to prepare, to purchase food and medication, transportation to clinics, help with bathroom, dressing, feeding, mobility, manage appointments, and offer emotional support and companionship. And that's the approach to this care agenda training that we're going to be embarking on. The principles of it, and I'm almost finished, will be to launch in a more systemic way a pilot geriatric clinic in St. Anne and St. Catherine. We have identified 2 sites. We're working those. So when you go to those geriatric clinics, it will have all the supporting ecosystem for people to go up without stairs, bathroom friendly, seating arrangement, plus the doctors are trained to support geriatric care. And the idea is to roll those out across the country, and indeed to give support through the community health aides in homes in preparation for an aging society. So it's a fundamental thing that you'll hear more about. So we're launching those. We're training the workers to support it, strengthening the partnerships with the Ministry of Labour and Social Security, National Council for Senior Citizens, local authorities, faith-based organizations, community groups to create an integrated approach. And that's going to be the CARE Fund, 500 million. There's a call for proposal on the 15th of June. We're going to be hosting an event in Kingston. I think they're moving around the country where non-governmental organizations can actually apply. We're teaming up with the friendly societies, cooperative or friendly societies. You have to be registered and governed as a NGO, and you can access funding with an appropriate proposal to be part of the outreach around the wider agenda of the social determinants. And that's through the CARE Fund. The only final thing I'll say is that we are moving on a number of other things under the social agenda. In another 2 weeks, we'll be unveiling a study which is almost complete on the impact of social media on our population and gauging the public sentiments around the possibility of restriction for age cohorts up to 16. We're doing a national survey, both quantitative and qualitative. I do intend to take that to Cabinet, the results, with some recommendations. And that's a conversation that we hope to promote in communities as part of the discussion. The same is to be said for studies being done on special, Roman energy drink, other paraphernalia that are not typical drugs, new emerging drugs, the Molly and the other stuff, vaping, All of those things are going to be part of the agenda going forward as we seek to engage communities. Thank you very much.
Wow, that was a lot. The minister is working really, really hard. Your sectoral presentation was very good, Minister. There was a lot that was in there. And wherever we can help, we know in the Ministry of Education, we will help because the work you're doing is really important, extremely important. I'm going to move very quickly to Minister Charles, and he's going to be very quick, he said, because he's been here a lot lately. And so he's going to just give you an update on what's happening with his spend, and then we'll go into the questions.
Thank you, Minister. Good morning, everybody. Good morning, colleague ministers, permanent secretaries, Professor Eldemire Shearer, and all. Just to indicate, since I'm here, I think it's important to note that the Ministry of Labour and Social Security was represented well at the International Labour Organization conference in Geneva recently. We still have some of our representatives there, continuing in the drafting of the platform economy standards that should be now for all of the members of the ILO. But in synopsis, Jamaica took a leading position in terms of representing not only the position through our national statement, but also representing CARICOM, leading on the areas of social dialogue and tripartism, which relate to the way government, employers, and employees, workers, come together to ensure that the labor market and the workforce continue to be strong. We also led in discussions relating to labor migration, just transition, and specifically the platform economy when we met with the Director General and asserted the position of the Caribbean to get more resources as we continue to develop our environment to be able to confront the uncertainties, climate change, technological transformation, including artificial intelligence, and other things that will impact positively and negatively the workforce. So, just to indicate that in relation to the ILO conference, it was successful on our behalf. In relation to the Hurricane Melissa, I want to announce that today we launch, Minister, HARP. HARP is the Humanitarian Assistance Relief Platform that has been developed by the ministry, and let me use the opportunity to give particular acknowledgement to Ms. Lana Facey and to the other members of the MIS team and our permanent secretary and others who have worked very hard, night and day, through all the frustration and calls from their minister to get this done. And we really want to say a big thank you to them. Again, the work that we do is sometimes not fully understood. We have been working on the ground since Hurricane Beryl when it comes on to the accelerated pace at the ministry, and it has not stopped. And so I want to acknowledge that team. So today we begin the pilot phase of HARP, which will be the tool utilized by the ministry to organize phase 2, which is the phase where we are validating those persons who could not be verified earlier because of whatever the issue is, whether it's TRN issues or phone number wrong or a building cluster issue or a duplication issue, whatever the issue is. Through HARP, we will have our team members out, or we have them out already, to gather that information, and it is designed to drive the authorization and authentication and to support user validation and to really now assist us in rectifying the issues and getting people their money. Remember, in phase 2, it is direct deposit, and if persons don't have banking information or don't have any bank account, we will be encouraging them, working with the banks to assist them in any way possible. And if they choose not to, then we'll find another methodology to get them their funding. So we are well ahead in that regard. We have a little under 5,000 of the remaining amounts that have been cleaned and are ready to be paid. And so we will be contacting using a number of mechanisms to get the banking information and get those persons their money. So in that regard, I want to make it clear we will be in the field, as we've said. The team will be out. We will publish a schedule to advise earlier. We will collaborate with the members of parliament, with the councillors, with the community leaders to ensure that all persons are aware of where we will be, when we will be there, so you can come, you can be able to bring your identification information, rectify your issue, and get yourself validated to receive your funds. We will also be in the communities, which means there are some persons who, because of the nature of the issue, for instance, a building cluster issue, that cannot be rectified by us simply seeing you at a location. We have to come directly to the location where the residence is or was, and that is also being done. We also have persons who are coming into the parish offices, particularly if they have a simple issue. For instance, a TRN issue where the TRN number was wrong, or the name was wrongly spelled, or you have lost your phone. Many thousands of persons fall into those categories. You'd be surprised to know how many. I give you a number. For instance, persons who have only, meaning no other issue but just TRN, almost 9,000. Okay? So those persons will have the opportunity to come into the parish office and rectify your issue there. And of course, if it is that you'll be receiving through direct deposit, you'll be asked to sign a client authorization form, which will give the approval to the ministry. And lastly, we will have persons from the ministry's team contacting some of the household representatives by phone. No one will ask you going forward for your banking information over the phone. If someone from the ministry calls, and please, this is very important to be clear. If someone from the ministry calls, they will provide you with instructions of how to receive your client authorization form, and you will be guided to provide that information to us via email to an official email that will end with mlss.gov.jm. So that's the update in relation to roofs. In relation to the spend, Minister, which I know you wanted me to speak on, Minister Williams really spoke to it, which was that the Ministry of Labour and Social Security received more than $10 billion and in terms of allocation. And to date, we have expended exactly the figure, over $10 billion. $31,441,855, and very important, 22 cents. That includes the $9.5 billion on the roofs program. It includes the pre-positioning of food supplies, post-hurricane food procurement and distribution, emergency response operations, administrative expenses, including bank fees, administrative costs incurred, the cost to procure support and resources, vehicles to facilitate staff in assessing the affected persons, and also $152 million that was received through UNICEF for grant support to PATH households and persons with disabilities. You'll also recall that there are additional amounts that were related to Hurricane Melissa that were connected to the Ministry of Labour and Social Security. And I give you an example, being the World Food Programme funding, which is not in this because it's not related to our budget. But there are several other churches, stakeholders and partners as well that have allocated through their budgets millions, I'd say up into the billions, that come together to be part of the comprehensive support that was given to the several persons impacted by Hurricane Melissa. This represents one of, if not the largest social protection, humanitarian assistance and disaster recovery intervention ever undertaken by this ministry. And so as we move forward, again, we remain focused on completing the validation and payment process for those persons who remain outstanding, strengthening accountability and oversight mechanisms, and to ensure that no eligible Jamaican is left behind in this recovery effort. Minister, record time.
Thank you very much, Minister. You've been coming here a lot because a lot of Jamaicans want to know what's happening with repairs and or social outreach to those in the West, and I want to thank you and the team for everything that you're doing. One of the good things about PostCab is that you have ministers here who can address issues as they come up. And one issue has come up while we're here in PostCab relating to NHF. And so Minister Tufton is going to come and just give you a quick update on that, and then we'll open for questions. Remember, we have an official funeral that we'll need to close off quickly for.
Right. Thank you very much, Minister. So there is something circulating about a breach of the database at the National Health Fund. There has been some communication from some deviant around this breach. So the NHF has confirmed receipt of a threat from a hacker group claiming to have access to some of the data. It's not yet confirmed, even though they have indicated some of the data that they say they have. It's not yet confirmed. However, enough evidence was gathered to require the agency to report the incident to the Office of Information Commissioner. That's an area falling under Minister Wheatley's portfolio. Additionally, the team has reached out to MOCA to update them on the situation, and will engage with the relevant agencies further for support with the investigation. Just to assure the public that the immediate steps have been taken to reinforce security protocols and hardening of the organization's security posture is ongoing. What's this data? This data is about medication and, maybe who benefits from what type of medication. It's confidential data. We don't reveal our history of medication administration. And we do get attacks on a daily basis, just as the banks do and so on. But I just wanted to raise this to the public because something is being circulated in this space. Thank you.
All right, thank you very much, Minister. And I'm going to take the questions from the media now. I'm going to just take all the questions, given the issues we have with time, from the media. Good morning.
Morning, everyone. Mahiri Stewart, Nationwide News. Here, question for Minister Maurice Dixon. State Minister of Finance Xavier Main told a JTA forum, I believe yesterday, that the government, due to fiscal constraints, can't by itself fund the education sector, and he suggested something of a layered approach in terms of fixing that issue. From your standpoint as education minister, what do you think needs to be done to plug that gap that the government can't fill?
Okay, all right. Do you have anything for Minister Tufton yet? We're just taking all the questions. Okay.
Sarah Burton, good morning, 18 degrees north. This set of questions, is for Minister Tufton. Wanted to ask regarding the CEO of the University Hospital of the West Indies, what role you had in supporting the appointment of Fitzgerald Mitchell. 2, there was a PAC hearing where the former chairman of the board of the University Hospital of the West Indies said that you overturned a decision that they made to essentially move on from Fitzgerald Mitchell, and that you were responsible for reinstating him. Is that true? Do you continue to support Carl Bruce as the chief doctor of the UHWI, despite senior doctors and nurses complaining about his management style?
All right, thank you. So I'll start with the education one, and that's a complex one in terms of funding of education. And through the Education Transformation Oversight Committee, that is actively being looked at. And I'm actually working on some new arrangements in relation to funding. So in another couple of weeks, you're going to hear how we're funding schools, and it's really interesting and very, very different. So please tune in and come to PostCab. I'll probably do it here. But, you know, there are different views on it because, you know, Capri did a study recently, and their view is largely that it's not really a matter of underspend. It's really a matter of, are we getting the results from all the spend that we do? And so there are different ways to look at it. And when I talk to a lot of parents, they feel that there are issues in the system that's not leading to the results that we want, and that we need to address some of those, and it's not really a matter of funding. And so through the Education Transformation Oversight Committee, that's being looked at. But also right now in the ministry, we're actually moving around budget so that we can fund in a different way, fundamentally different than we've been doing it in the past. And I think that will address some of the issues too. But again, that one is going to be based on results, because you can't just keep putting money at an area and not get the results that Jamaica needs to see. So sometimes it's not more money, it's really efficiency of that spend. So tune in for more information on that one. Minister Tufton, you have the floor.
Thank you very much. Okay, so the answer to the first question is quite simple. Ministers don't appoint CEOs, and any cursory investigation will reveal how CEOs are appointed. And that hopefully should address any concern over my involvement. Secondly, ministers don't appoint chief medical officers either. I think that's his title, Dr. Bruce, either chief medical or medical chief of staff. And I believe he held that position before I became minister. So again, that should clarify that. The third question about the chairman, the former chairman's statement at the PAC, I believe if you had followed the PAC matters, the subsequent meeting after that, there were evidential documentation read out at the PAC that made it very clear that the board at no point took any decision either around recommending an appointment, and something as significant as that I would imagine would find its way at the board level. I'm not on the board. I can only go by what is read, and therefore that should, to overrule something that never took place, clearly there's an issue there. But, you know, as I said, it may have been not remembering exactly what happened. I gave the former chairman the benefit of the doubt. I'm not one to condemn people, but I think clarity is important, and I believe clarity was had. Thank you.
All right. Thank you very much, Minister. Minister Williams had to leave because she had a meeting with another group, negotiation time. And so we have to close out because of the official funeral this morning. And so just as a reminder, 67 billion spent across ministers. Minister Tufton would have gone into Ebola. There is no Ebola here in Jamaica. We also have our Minister of Labour and Social Security talking about new initiatives. So even though they've gone so far with the roof program and all of the work there, he was announcing the new HARP program, which is their new database that they're also launching and system that they're launching. You also got an update on the NHF issue in terms of data breach. There is also, just to note, we have some students here and other members of the media. When we close, you do have the customs agency here, you have the ministers here, you have Dr. Eldemaya Shearer here, you have people from the Ministry of Education. So there are many people here who can answer additional questions that you may have. As we close out today, we're having the official funeral for the Honourable Hugh Hart. And for the young people here, he served in the Senate on 2 occasions from 1972 to 1976, and again from 1983 to 1989. He was also appointed to the cabinet as Minister of Mining and Energy, and he also served at the same time as Minister of Tourism. Very interesting portfolios. And then last week, Saturday, we had the official funeral for former senator, and he was a minister in the Ministry of Economic Growth, Leslie Campbell. And so we're losing a lot of our stalwarts, persons who've served a lot. And as you young people are here, I ask you to look on the lives that these persons lived, lives of service, and I'm hoping that some of you will one day take on that baton and move forward in terms of governance. That's why you're invited every week. So we have young people here every week because we want them to aspire to be Minister Tufton, Minister Charles, and we also have Minister Rhoda Moy Crawford. That's what we want, and that's why you're here. And so as we close out today and as we celebrate the lives of those who have served this country so well, as always I say, may God continue to bless Jamaica, land we love. Thank you all.